this episode, I'm going to comment on something that I saw on Instagram. There was a post someone put up and it said, people love to go to the doctor for a diagnosis and then refuse to do the work to help themselves. Your pain having a name doesn't make you better. I think that's interesting. I'll read it one more time. People love to go to the doctor for a diagnosis and then refuse to do the work to help themselves. Your pain having a name doesn't make you better. This is going to be, it's kind of controversial. I will have to say, for a large population of people, this is 100% true. Obviously, if you're listening, you can think of examples where this might not be true. It's not going to work for everybody. But I think this paralysis by analysis mentality is pretty common. Some people will start off like this. They'll have pain and they don't understand the pain and they want to put a name on it. So they immediately start going through the pipeline to try and figure out what is the quote root cause. Other people arrive at this type of mentality through trial and error, unfortunately. So someone may have back pain, they go to a chiropractor. The chiropractor might image them, they shoot some x-rays, tell them that their spine's out of alignment, and then they give them a treatment plan where they're coming in multiple times a week, getting their back cracked. They might feel a little bit better, but they never really get what they want out of it. When that fails, a lot of chiropractic offices have other things they can use. So they might throw some laser at it or some e-stim. You might see some shockwave therapy, different things like that. They might change up the adjusting tool. So instead of cracking backs with their hands, they might use some type of instrument. You might get a little bit of soft tissue therapy. When these things don't work, people might start looking at massage, which usually feels good, but maybe doesn't get them the results that they want. Maybe you sprinkle in some physical therapy in there where someone's going in. And again, kind of just getting what I would consider to be maybe like a conveyor belt type therapy. So you come in with low back pain, everybody gets the same treatment. And this is something that patients complain to me a lot about. They feel like everybody's kind of doing the same thing wherever they go. So people go through that long enough and they don't get the results that they want. They start to seek answers and now they really want to know. So they might go the route of more imaging because maybe at this time it's been a while since they got their x-rays. So they may reshoot x-rays and then they may use that to justify getting an MRI. And again, this is like this paralysis by analysis starting to set in where people, they've been through a lot of treatment and they haven't got the results they want. So they just decide that logically to stop, pause, and figure out what the root cause is. This makes a ton of sense, but I think that this is what the Instagram post is getting at, where people are trying to now put a name on their pain. They want it to be labeled because of the perception that once it's labeled, there's a clear path towards getting better. And unfortunately, that's not always the case. So I think, although I agree with this quote to a certain extent, I also understand how people get there, and I understand why people want to put a label on things. Let me explain. When someone comes to see me, I'm usually not the first choice because I don't take insurance. So a lot of people, I see them after a lot of other things have failed, which is advantageous for me because I know what's definitely not going to work. And usually by this time, people are pretty open. If they're coming to pay cash, they're pretty open to trying something. And I usually get some pretty good compliance out of people who are paying cash. That's an advantage. But when someone comes to me, I take that seriously and I think, okay, we'll stick with low back pain. Someone's coming in with low back pain. I'm not going to make any assumptions. it could literally, before I meet them, it could literally be anything. And I don't want to just overlook something that might be, I don't know, a little bit more serious or a little unique, because I want to treat each person like a unique individual and at least do my due diligence to cross as many things off the list. So when someone comes to see me, before they come in, they filled out a full health history. My health history form includes sleep questions, it includes nutrition questions, it includes questions about if they're stressed out or they have anxiety or they're dealing with depression. I'm really trying to get as well-rounded of a picture as I can before the person comes in. And then I hear their story. I let them talk. And as someone's talking and telling me and giving me this story, I am crossing things off the list, figuratively in my mind and literally on a paper. And then once they're done talking and telling me everything, then I do a physical exam. Once I do the physical exam, I try and cross some more things off the list. So you can see how this process works. I don't make any assumptions. You come in with something common like low back pain. It could literally be anything. I cross as many things off the list as possible. Then once we've talked, I've heard your story, we've done the physical exam, I look at all of the possibilities that are left, everything that I haven't been able to cross off the list. And I think, would my recommendations differ a lot depending on what's left on the table? And if the answer is no, which is very common, we don't really need to nitpick on dialing it in anymore. Now, I'm a curious person. So if I spend, a month or two working with someone, I'm still crossing stuff off the list just because I'm curious and I want to know. So I do try and refine that. But this is the process of creating a differential diagnosis. So I will just write, in someone's chart after that visit, here's a list of things that I haven't been able to cross off the list yet. Now, if we look at that list of things I can't cross off the list, and something in there would require drastically different treatment, then I can explain that to the person. My patient would know. I'd say, okay, look, it could be these things, and these things will respond well to this type of therapy that I can provide and this type of treatment plan, but it could also be this thing. And this is maybe I would have to write you a referral letter to go somewhere else to either confirm this or to have this evaluated by someone. So this is, and that would be usually if it's beyond my scope of practice. For example, we need a physician or a physician's opinion at least. But that is kind of rare. But the idea is I need to cross off the list as many scary things as I possibly can. I need to address as many concerns as I can. And then we don't necessarily need to nitpick. I don't necessarily need to put a specific name on it because, to be honest, with low back pain, you've got the discs and you've got, the main discs between the bones. Everyone's probably heard of that. So a disc herniation or discogenic pain, something coming out of the disc is pretty likely. And then you've got little joints on the backside behind, we call them facets. So disc pain, facet pain, you don't actually really have too many options of like an anatomical structure that's producing the pain. You've got some nerve stuff coming out of there, but ideally we've ruled out, nerve issues. So we can do that with a neurologic exam. And so the funny thing, it's not funny, but the interesting thing is that I have had in the past, and this will continue to happen, people who want to put a name on their back pain, and that's not enough. They want to know definitively what's wrong with them. And what will end up happening a lot of times is, they've been through the ringer. They've seen other chiropractors. They've done PT. They may have done medication. They've done rest. They feel like they've done everything and they want to know. And then they go down that route of imaging. And a couple months later, I'll follow up with them and they'll be, yeah, it's great. I had an MRI. I just got the results back and it's a disc herniation. And they'll be really happy with that because they put a label on it. But the interesting thing is that, with a disc herniation, which is very common, we don't need we could have already started working on it. And again, I don't blame the person who's seeking that, because a lot of times these people have had failed treatment. So they don't believe me when I say that I know how to handle it. In this podcast, I'm not really going to talk specifically about what I do for any of these injuries or these conditions. But I think it's important to note that there are ways to deal with things like back pain or elbow pain or knee pain that aren't standardized. And I'll give you a really good example. So I did a workshop, a shoulder workshop recently, yesterday actually. And everybody in the workshop, we had 5 people, they all had shoulder pain. They all would probably describe the shoulder pain in a similar way. And when we were testing and we were looking at flexibility, mobility, range of motion, we had one person out of the 5 who had incredible range of motion. Everybody else was super stiff and tight, and getting into those positions, different positions, hand behind the back was tough, going overhead was tough, bringing the arms out. There was a lot of stiffness and achy movements. And we had one guy who just had great mobility, but he described his shoulder pain in the same way a lot of these other people described it. So you can imagine, let's say all 5 of these people decided that they were going to go get imaging. And let's say the imaging came back and all 5 of them had a rotator cuff tendon problem. Well, if we had a standard treatment plan, so let's say you go to a physical therapy clinic that just has standardized programs, or you go to a chiropractic office that just basically adjusts everyone. So everyone gets the same treatment. But you have people who have different reasons why they have that rotator cuff problem in this case, right? One guy has incredible mobility. So a lot of these programs that a lot of these people are going to get are going to involve stretching and mobility work and different things like that. Well, this one person, and it's really, I mean, statistically significant, because it's 1 out of 5 in this group would not have responded well to mobility work. The mobility stuff, the stretching, all of those things that we did in the workshop were not really beneficial to him. He needed some strengthening exercises. He needed to find better positioning. He needed coaching with the specific movements. He needed a path to desensitize the tissues. It was just going to be a uniquely different route for this one person, even though on imaging it may have been the same thing. He may have had the same imaging findings as everybody else. And we see this with low back pain. You know, if you have, let's say you have someone who's really good at yoga. This person, she's been practicing yoga for a decade. She's a yoga instructor. She's very bendy. She was in gymnastics before. She's done all those types of sports and activities like dance, gymnastics, yoga. And then let's say we've got someone and she is a competitive power lifter. And let's say they both have low back pain and they both go get imaging and they both have a disc herniation, and the disc herniations almost look identical, but even in the same levels. Well, there's not going to necessarily be the same treatment plan for both, right? One of them has maybe excessive mobility. I don't know. We'd have to look at that, and maybe would need a different path. Where someone out, the lifter maybe has lax mobility. I don't know. We would have to look at that. So that's the interesting thing if I go back to this quote, when it says your pain having a name doesn't make you better. I can't argue with that. The pain, you're just putting a name on it doesn't necessarily make it better. And I think there's this very logical thought process where if I just knew, if I had the label, then I could go and I could look up what the best treatment is for that label. And I think for a lot of these things, they're just, that doesn't exist. Just getting a name for it doesn't necessarily mean that you're going to find that the path to getting what you want is just going to illuminate unfortunately, because everybody's so different. Now, what imaging is great for, what putting a label on is great for, is if you've got something that needs medical attention. So you got a broken bone, you got a tumor, you've got actual instability, let's say like instability of the spine. These are all really important things that we can tell, and imaging can help with a lot of these different things. So, but also in the process of taking a history and doing an exam, and like, for example, I'm not the only one who does it, but if you spend an hour with someone and you get to know them, those things like broken bones, instability, tears, things like that, they're glaringly obvious. I mean, most of them are. You usually don't miss those things. So when I read this quote or this Instagram post, I had mixed feelings. Oh, overall, I like it. I think it's very, unfortunately, it's very true. I think the way it's worded, and I don't know the gentleman who posted it. It's hard to tell what people were thinking when they write it. I think when people read this, unfortunately, they might think that, this person who put this on Instagram is, I don't know, it seems belittling a little bit to me. And it obviously doesn't represent everyone. But if you're out there and you've got paralysis by analysis and you've been through the ringer and you don't know, and you feel like no treatment has worked, therefore you need to put a name on it, it could be the case. But if it's something musculoskeletal, a lot of times we don't need to put a name on it. And that's what I'm saying, is it's nice to, and I like that process, but I think that the differential diagnosis process of, we're not just looking at one diagnosis, we're looking at all the possibilities, and we're systematically crossing as many off the list as we can. And then we have a list of whatever is left. And a lot of times what I like to do is I'll order them in a sequence of most likely to least likely, if I can, or most serious to least serious. And I'll start at the top. We're going to start by addressing whatever I think is either the most likely or the most serious. And it works quite well, because we look at what we think they might have, and then we look at what the person ultimately wants to be able to do. So what are their goals? So let's say someone's got shoulder pain. Okay. Could be a rotator cuff, could be a tendon, rotator cuff tendon, or could be a muscle. You could have arthritis. You've got decreased joint space. We want to obviously rule out tears. We want to rule out nerve problems, especially nerve problems coming out of the neck. We want to rule out tumors. We want to rule out as many things as we can. And if it's just like, well, there's probably, for a lot of shoulders, what it ends up being, once we cross all those things off the list, as many as we can, it ends up being, at least for a lot of my population, is they probably have a little bit of arthritis, osteoarthritis, so they have decreased joint space. They've probably got some type of tendon issue. And a lot of people are chronically weak, and they're tight. So if you're weak, tight, you've got a tendon, an angry tendon, and you've got less joint space, that's a problem, right? But we can address all of those things. Mentality is also a big problem. So if you expect pain, you're going to get pain. So we start to work on the sports psychology of it, where we're just trying to get start stacking wins, getting some movement in that's not super painful, to try and kind of reframe the way people think about these things. And I think that's really important. We also have to consider all the things that putting a label on it won't address. And this is the stuff that people usually don't want to talk about, where if you're going through a treatment plan with me, at some point we have to at least think about it. And this is like recovery stuff. So how good is your sleep? Not how long is it, but like the quality. Is this partially a sleep issue? What's your nutrition like? And we can get specific about it. Like we can start to measure, like how many grams of protein do you eat each day? Which fiber are you getting? Fruits and vegetables. We need to ask those questions. So sleep, nutrition, stress, anxiety, depression, unfortunately very common. I can't help with a lot of those, but if they're a problem, those are something that's where like co-management comes in. We look at training and rehab schedule. Are you burning the candle at both ends? Are you trying to do too much? And we look at things that you're doing that maybe you don't need to be doing. So some people feel tight, so they stretch a lot. Well, maybe you don't need to be stretching. Maybe your muscles are sufficiently long, you just feel tight. That happens. So maybe through this process, we can buy you back some time that you can repurpose. But we also look at like other health issues. So some people have other chronic conditions going on, and those might have an effect. We think about, well, are there any side effects of any of the medication you're taking? Could that be part of it? And yeah, I think when you start to look at that whole picture, you realize that most people have more going on than just the name of the diagnosis. And I think this is getting back to the quote, which is what I really like, is like, your pain having a name doesn't make you better, because pain is multifactorial. It is outside and bigger than the diagnosis, the thing that you see on imaging. And I think that gets lost a lot, where people, I think I've brought this up on previous podcasts. I had a conversation once. I was doing a career event at a college for people going into healthcare. And it was a panel, and they had a bunch of people with different healthcare professions. And then there was a breakout session where we would go sit at our tables, and then students who were interested in potentially going to grad school and pursuing one of our careers, they could come ask us questions. And I had a young woman who was seriously thinking about going to med school come and talk to me. And we were having a discussion somewhere along these lines. And she said, well, and this is a great question. She said something to the effect of, what happens when someone comes in and they don't have any of this other stuff going on? They're just in pain. And I thought about it. I was like, I've never seen that patient. So what you're saying is, what happens when someone comes in and they're sleeping 8 to 10 hours a night, and their sleep is amazing. They wake up feeling so restful, and their nutrition is locked on. They don't have any extra body weight. They're just feeling great. And they have no stress, no anxiety, no depression. And, they're meeting physical activity guidelines. They're getting 8,000 to 12,000 steps a day. They're resistance training 2 to 3 days per week. They're getting moderate to vigorous cardio in, anywhere from 75 minutes a week all the way up to 300 minutes a week. They have great relationships with their friends. They have great relationships with themselves, so they're not hard on themselves. They have no comorbidities. There's no other health issues. There's no history of injury. There's no history of chronic health issues. There's just no concerns. I've just never met that person. Or that person, I mean, those people may exist, but then no one's ever walked into my office, and I can't even think outside of my office if I know too many people who are like that, who aren't like, 6 years old. I think that maybe describes my 6-year-old son. He sleeps like 12 hours a night. He has no chronic health issues. I don't know. I mean, he probably meets physical activity guidelines for a kid. He's just very active, plays sports. His diet isn't great because he's super picky, but you see what I'm saying? If you have a chronic problem and you're not getting the results that you want, and you've been through a lot of healthcare providers, there may not be anything wrong with the treatment they've been giving you. It may just be like a small slice of the pie. Then the whole pie is your recovery, because maybe they're only focusing on manual therapy, putting their hands on you, or they're only focusing on, I don't know, soft wave therapy, or they're only doing massage, or they're only doing isolated rehab exercises, and they're not connecting the dots, looking at all of the other things that go along with pain. And if they're not actively trying to help you work on meeting physical activity guidelines, and at least be aware of all these other things that could be affecting your pain, that could be a reason why you're not getting the results. And, I don't know. And again, I'm just going to keep coming back to this quote because that's what this podcast is about. People love to go to their doctor for a diagnosis, and then they refuse to do the work to help themselves. I don't love that part about it. But then he goes on to say, your pain having a name doesn't make you better. So if you think about it, I love the cup analogy. So if you visualize a cup, and when the cup and water is going into the cup, and when the cup overflows, that's when someone maybe has a chronic pain episode. So you think about all the things that are in the cup. If you're not sleeping well, maybe you're getting a decent amount of sleep, but it's not really good quality sleep. You're going through a lot of stress. Maybe you're someone who suffers from anxiety. You look at social media too much. You're stressed out about all the stuff that's going on. Maybe you're one of those people who just gets really angry about politics. You're worried about the environment. There's all these things that you can't affect, but they're weighing heavily on you. And then maybe your diet isn't amazing. You're carrying a little extra weight. You snack too much. Your energy's kind of low. You're not even close to meeting physical activity guidelines. There's a lot going on there. So all of that stuff is filling up your cup. And then on top of that, when there's barely any room left in the cup, you go and you herniate a disc helping your friend move. You're picking up boxes or something like that. And then, you want to go to the doctor for a diagnosis, and you get the imaging and they put the name on it. But what that imaging and that name doesn't show is everything else that's in the cup. The MRI isn't going to tell you that you're sleep deprived. The MRI isn't going to tell you that you're, the changes you need to make in your diet. The MRI isn't going to talk to you about your anxiety with the current administration, or with things that are going on in the world, or with your stress about the environment, or whatever is keeping you up at night, or getting your attention on social media, whatever the algorithm is throwing at you. Imaging doesn't show you that. Your diagnosis doesn't show you that. So there are so many things going on for the pain experience. And that's the thing that I think is frustrating for me as a healthcare provider. And I'm assuming the gentleman who posted this is a strength and conditioning coach who's quite good. So the thing that would frustrate me, and I'm assuming him, is that people will really want to put that name on it when there are healthcare providers and coaches out there who will say, okay, we don't necessarily need that. We can start working on this now. Why don't you delete Instagram and let's get you moving in a program in the gym or in a rehab environment that's going to get you going, working towards your goals. Let's make a list of all the other things that probably need to change. We don't have to change them right now, but we can start to make that list. Is it nutrition? Is it sleep? Or is it your expectations? Because we can start to reframe your expectations with rehab and movement and things like that. And then we just start focusing on your goals and what you want to be able to do. And you start having some fun with it, because injuries and pain, those can be an opportunity. It's an opportunity for growth. It's your body's requesting a change. It might be requesting a change. I don't know. You could look at it that way. I love looking at it that way, as pain and injury being a request for change. But what are those changes? We can start to ask those questions. These are great. These are life-changing questions, because we're not just talking about improving your pain, right? Because if we're actively thinking about improving sleep, improving nutrition, meeting physical activity guidelines, less stress, less anxiety, we're talking about health. That's the cool thing, is a really good rehab program that phases into a really good strength and conditioning program that blends seamlessly into your life, that forces you to confront a lot of these tough questions, man, think about the power that has long term. It's life-changing. It can be life-changing. So although I don't love every part of this post, on the balance, I think it's great. It's a little provocative, but just keep in mind your pain having a name does not make you better. And there's a lot of ways that it can trip you up. Now, I will say I would not discourage someone from putting a name on their pain. I want to. A lot of times I do. But I really try not to, because who am I to judge, or who am I to know? Maybe that's something that someone needs. I think more often than not, it ends up going down that route ends up causing problems. Because people carry those labels like a cross, unfortunately. I can't tell you how many people will come to see me, and not only do they have this diagnosis that they're wearing like a monkey on their back, but they've got images on their phone. Let me show you my x-ray on my phone. So I feel so bad for those people walking around, because that's how they identify. So anytime anything happens, it's like, oh, it's my tendon, or oh, it's my back, or it's my arthritis, or whatever. And it almost becomes part of their identity. And it's unfortunate, because it's a psychological barrier. Because how many people out there have arthritic joints? I do. Everybody has degenerative changes in their joints. It's so common. So I don't know. It's it's not something to be freaked out about for most people. And how many people out there have a tendon problem? I do. I have lots of them. You know what I mean? It's so common. But what will end up happening is people go and they're looking for that name, and then they find someone to do that, and then they get the name, and then someone can make that name sound really scary. Or, and a lot of times the healthcare provider is not trying to make it sound scary. They're just rushed. And so the very frank explanation about it, it gets lost in translation. It freaks people out. Well, that's it for this episode. This is really like a stream of consciousness episode, because I just saw this Instagram post pop up on the algorithm just threw this one at me, trying to stress me out and give me anxiety. But you know what? I don't know. I looked at it for a long time, and I saved it, and I thought, what a good opportunity for an episode, because I think there's a lot of people out there going through paralysis by analysis. When we could just get going right now, we could figure it. We can still figure it out. We can put a name on it, but putting a name on it, we don't need a name to start. Throughout the process, yeah, let's slap a name on it if that's what you want. We'll keep working on it. But most of the time, it doesn't matter. A lot of times, it doesn't matter. I can't say most of the time. It's very common for it not to matter, unless it does. But to be honest, we'll figure that out. If you're with someone good, they're going to figure that out anyway. Because we're always in that process of ruling out scary things, ruling out those red flags and those yellow flags. All right. That's it for this episode. Thanks for listening, and I will be back with you soon.